Hello, my name is Dr. Eric Dorninger. I'm a naturopathic doctor and licensed acupuncturist here in Colorado, USA. And today we're going to talk all about CBD, cannabidiol, and menopause, supporting restorative sleep and hormone balance. I've been in healthcare for 30 years and private practice for 22 years, and I've dedicated my entire life to understanding the root cause of chronic and mystery illness. And it all comes back to inflammation. I run a conference called CIRS-X, Chronic Inflammatory Response Syndrome. I deeply track plaque for preventing heart attack and stroke, and it is inflammation, not cholesterol, that is the root of all premature heart attack and stroke. So to no surprise, today we're going to give you all the tips and tricks we know for managing inflammation and graceful aging during perimenopause, menopause. Perimenopause and menopause are totally natural and they are totally inflammatory. And we forget to honor estrogen and progesterone as potent anti-inflammatory immune modulating anabolics. That is, they help balance the immune system, they help prevent autoimmunity, and they rejuvenate, regenerate, resuscitate the tissues. And when estrogen and progesterone fall, lids on the jars of inflammatory cytokines open up and start to burn down the body. These inflammatory cytokines like interleukin-6, IL-1, tumor necrosis factor alpha are literally what's behind osteopenia, osteoporosis, sarcopenia, brain atrophy, and the development of arterial sclerosis or clogging your carotid, coronary, and peripheral arteries with inflammatory, soft, and hard plaque. We have to get in front of inflammation, and we have to prepare for a graceful perimenopause and menopausal tradition. If you're a man, you need to hear this talk for your sister, for your wife, for your partner, for your mom, for your grandmom. There is a better way for transitioning into perimenopause, menopause, and it all comes down to understanding and managing inflammation. Cannabidiol is a unique novel molecule that is incredible at modulating inflammation. And the higher your pre-menopause and perimenopause inflammatory status was, the more you've depleted your endogenous cannabinoids or your self-made God-given cannabinoids that you create from eating healthy dietary fats. Everything from avocados to olive oil to fish oil do in some way or another downstream into endogenous cannabinoids, and the more inflammatory experiences you have, Crohn's disease, migraine headaches, SIRS, rashes, psoriatic arthritis, ankylosing spondylosis, rheumatoid arthritis, the more you're going to deplete that reservoir of self-made endogenous cannabinoids and be able to use cannabidiol to restock the coffers of anti-inflammatory molecules that allow for a potent anti-aging graceful transition. So, in sum, don't forget, estrogen and progesterone are not only anti-inflammatory, but they also help promote the binding of other anti-inflammatories. Estrogen helps serotonin binding in the brain so that you have enthusiasm and don't feel depressed during life transition. Progesterone enhances GABA in the brain, our cool, calm, and collected hormone, and this is one of the reasons that the decompression from GABA that allows us to sleep gets thrown off when we see perimenopause, menopausal change. So manage the inflammation and make sure that your patients are prepared for a graceful menopause and learn how cannabidiol can help with everything from mood to pain to sleep to frozen shoulder and everything else that perimenopause, menopausal women have happened to them. I had an incredible mother growing up, and she did everything for everybody. And I think how I would have loved to know what I know today from my mom so that she could have had a more anti-inflamed, empowered menopause, including holding on to serotonin for enthusiasm and GABA for feeling cool, calm, and collected. So, a couple of sleep spirituals from the CBD world. I worked at a retirement community for 10 years, and in the States, retirement communities are independent living, where you're still playing your pickleball and going to the opera and going hiking, into assisted living, where you need some help with your day-to-day operations, into memory care. And this was a Cadillac facility, which means it was the best of the best, and they had a wellness center. But I'll tell you, the sleep problems, the pain, the musculoskeletal issues, the GI problems, the aging brain, all aftermath of inflammation were rampant. And their favorite over-the-counter medication for a good night's sleep was Advil PM and or Tylenol PM. And we know that these can be miracle drugs. Acetaminophen and ibuprofen are miracle medicines with proper application in judicious short-term methods. But if you're on Advil PM and Tylenol PM every night, it is not if but when you're going to destroy your intestinal lining, your liver, and your kidneys. So we have transitioned people into using the Blue Sky sleep gels, which is 25 milligrams of CBD and 25 milligrams of CBN. The CBD helps dampen inflammatory cytokines, so our natural cycles of melatonin and restorative growth hormones can flood the body and help you stay asleep for more than 5 hours and dive deep into those restorative moments. We hear from customer after customer how their smartwatch or their smart ring algorithms go from 30s and 40s into the 80s and 90s after just a couple nights of 1 to 2 Blue Sky sleep gels, 30 minutes before desired bedtime if you have difficulty falling asleep, at bedtime if you have difficulty staying asleep. I talked on an interview this morning about keeping some of the Blue Sky sleep gels for that 3 a.m. waking with a glass of water and taking it to get back to sleep so that you don't have such a hardcore cortisol and adrenaline spike now kicking you out of restorative sleep for the rest of the night. You're trying to put in the time to pay off the crime of daily inflammation and wake up zippity-doo-dah. And if you have that cortisol adrenaline spike in the middle of the night, it all goes to pot and we don't get into that deep 3rd, 4th, and 5th round of REM and restorative growth hormones that bathe the body with anti-inflammatory, antioxidant, rejuvenate, regenerate, restorative process. So let's get the world sleeping. It'll be a more kind, gentle place if we all wake up rested, and really consider the Blue Sky sleep gel if everything you're doing with your patient isn't working, if everything you're doing with yourself isn't working. And use data feedback. If you have a smartwatch, we love hearing from our customers and from patients and clinicians to show that repeat of 30 to 40 goes up to 80 to 90 on body batteries and the algorithms of regenerative restorative sleep. So, moving into sleep. Don't forget, postmenopausal women have higher rates of sleep apnea. When the ovaries retire, they pass the baton to the adrenal gland. The adrenals release 2 very important hormones, glucocorticoid or cortisol, which is your blood sugar hormone, and aldosterone, your blood pressure hormone. So we can see perimenopause, postmenopausal women struggle a lot with blood sugar issues. We thank our nutritionists and our integrated providers who help balance blood sugar and use constant glucose monitors. Maybe 2 glasses of wine ain't working. Maybe the THC gummy is creating the munchies and kicking you out of restorative sleep. We have to figure that out with our patients. So you know my rule, you want to always follow the oxygen and follow the fuel. I love using overnight oximeters that record on a phone and show you if your patient's dropping below 90% because bing, that will freak out the brain, spike cortisol, norepinephrine, epinephrine, and kick you out of restorative sleep. The sleep gels can help dampen and blunt that cortisol and adrenaline, but we still want to make sure we're thinking about things like sleep apnea. In regards to blood sugar drops, a constant glucose monitor can be a patient's best friend to see if they're really getting away with that dessert before bed. Maybe they need an avocado and some turkey slices to balance their blood sugar through the night. And maybe they have to really pick and choose wisely with their caffeine and alcohol consumption. So these are the things we need to start thinking about in regards to perimenopause, postmenopause. It's all about the inflammation. So in our slide deck that you have access to, we're going to be talking about all of these different things. We discuss a lot of these on my YouTube podcast, The Vitality Hour. We invite you to subscribe. It helps us get things like heart scanning and SIRS. and oxygen and blood sugar out to the masses. On @Dr. Eric Dorninger, I post a lot of stuff about inflammation, and then Blue Sky has an IG as well, where we're trying to educate the public on graceful, healthy aging. You want to put 3 things in the bank: perimenopause and postmenopause. Clean arteries, big plump brains, and lean muscle mass and bone. If you invest now, you will have the assets later to not get a foot fracture or a frozen shoulder, or spend all your hard life savings in memory care, or have the #1 killer of American men and women, premature heart attack and stroke. So today we're talking about inflammation hunting and inflammation killing, and our mission to create healthier communities. We like to do things like sponsor the Colorado Association of Naturopathic Doctors. We love speaking in the UK and Dubai and all over the world on what's taking everybody out: inflammation. Doesn't matter who you are, once you start triggering inflammation with diet, lifestyle, apnea, water damage, buildings, concussion history, post-surgery, tooth abscess, and more, you're going to have to replenish endogenous cannabinoids and shore up your anti-inflammatory bank accounts. I love the Blue Sky line because it's 0 THC. I have no issue with decriminalizing cannabis. However, many of our patients are super sensitive to THC and the blood sugar effects and the anxiety and paranoia that some can get with that. Our products are intentionally final batch tested 0 THC, and we implore all who need it, like firefighters, EMS, police officers, government workers, to be able to use a non-THC product that can help balance mood, help with pain, prevent the use of oxy and benzos for things like sleep and post-op pain, and have a healthy way to manage inflammation in recovery. We are third-party tested for purity and potency on every final batch of every single product line. And what that means is we have a certificate of analysis to say the milligram amount in that capsule or tincture is 10% above or below the label. So if it says a 30 milligram cannabidiol, it should be 27 to 33 milligrams, not higher, not lower. Potency and purity matter so that you can dose according to clinical trials to get the same outcomes for things like anxiety and Parkinson's and smoking cessation and MS spasticity and headaches and IBS and so on and so forth. So the quality of your cannabis isolates, cannabidiol, cannabinol, and cannabigerol are so important to get to mimic what we're seeing in the very potent medical literature on these miracle molecules of immune modulation. And then lastly, purity. What's in a product is all the things that should be in a product, nothing more, nothing less. So most of our products are simply the isolate, CBD, CBN, CBG, and MCT oil with a gelatin cap or a straight tincture. And we take pride in bringing pure, potent formulas that have value in the per milligram per price that can match the medical literature. So once again, you, your patients, and citizens can see the same results that we're seeing in these exquisite anti-inflammatory immune modulating medical studies, whether it be on Parkinson's or MS or headaches or IBS or anxiety. And we want to remind everybody that every single mood disorder known to humans has higher levels of inflammatory cytokines than healthy controls that don't experience that mood disorder. For example, someone who has anxiety has higher levels of inflammation in their brain than someone who doesn't have anxiety. Someone who has schizophrenia, bipolar, ADD, ADHD, OCD, major depressive disorder, depression, they all have higher levels of inflammatory cytokines than those people without those mood experiences. Don't forget how intense anxiety and depression can be during perimenopausal, menopausal change. This is not necessarily a life transition experience. This is a life transition and dramatic escalation of inflammation on your brain, and you need to control that because you've lost those beautiful molecules of estrogen and progesterone that serve as lids on your jars of inflammatory genes. Once estrogen and progesterone drop, pop goes the weasel, And here comes the inflammatory state of perimenopause, menopause. It is normal to contemplate life and my kids and empty nesting and who am I and what do I want to do as another career, and I'm taking care of my aging parents, and what's the bigger picture? Is there something bigger than me out there? All of that is normal, but you can get in a downward spiral when your brain is on fire with inflammation, going through these big life questions that are totally appropriate, but totally need to be supported in regards to an inflammatory paradigm so that you don't get clobbered and just want to suck your thumb and lay on a couch with postmenopause and menopause. The same experience happens to men as andropause, but it happens delayed and it's a slow kill. The tire just pops with perimenopause, menopause. With men, it's the same transition, but it's a slow bleed, and we have to take care of them too. But today is about that sometimes rapid, fierce, violent, inflammatory uptick that can come with perimenopause, menopause. So, how does CBD do everything that I've been talking about this morning? CBD modulates serotonin by acting as a 5-HT1 receptor agonist. That is the most prolific serotonin receptor in your brain, and CBD helps bind and modulate that. This keeps you in a state of enthusiasm. So if you're going through perimenopause, menopause, and your partner asks you, hey, where do you want to go out to eat tonight? And you go, I don't know, you choose. That is low serotonin. If you say, hey, there's that new Chinese place that's doing gluten-free, we should check them out. That is serotonin. So we want to make sure that you understand serotonin and the 5-HT1 activation enhances enthusiasm, gives you improved mental acuity, decreased aggression, increased social gregariousness, decreased impulsivity, inhibition of drug-seeking behavior, and supports libido and arousal. So it has a lust for life rather than an agitation in life. The other thing about the 5-HT1A is, remember, that is the most ubiquitous serotonin receptor in neurology. There's nowhere else that serotonin binds so wonderfully. 5-HT1 agonists have been used to dampen nausea, which is one of the reasons why we think that CBD works so well for things like IBS, Crohn's, ulcerative colitis, so on and so forth. If you have constant reflux in a perimenopause, menopausal woman, don't forget sleep apnea also drives GERD, reflux, because when you choke out, you go, right? And then you suck your stomach acid contents into your esophagus and burn those fragile single columnar epithelial cells. So don't forget to keep doing your deep dive, inflammation hunting, inflammation killing, but one of your inflammation issues is endogenous cannabinoid deficiency syndrome. All of these decades of a full throttle, take care of everything and everybody. I've concussed 5 times now. I've had 2 surgeries. I've been eating Krispy Kremes through college. I finally started a gut cleanse and took care of my blood sugar in my 40s. All that adds up and has been depleting your endogenous bank account your entire life. Cannabidiol restores your self-made cannabinoids and also has 5-HT1A agonism, which means, the stomach's a little more calm. Hey, the brain's a little more enthusiastic. Serotonin also has anti-inflammatory properties for things like musculoskeletal pain. So dopamine. Dopamine is responsible for ambition and drive, feelings of self-worth, courage, part of our cerebral libido, decisiveness, hopefulness, and the ability to finish tasks. As we go through our oldest leaving for college, we got 1 more in high school, it's an intense time, even as a man and as a dad. But for my wife and being a mom and seeing our sweet, awesome, kind, productive young man get after it, we're super proud. But there's a lot of loneliness coming in. We miss him. We miss the conversations. When you have dopamine, you have hopelessness, you have ambition and drive. You say, I miss him, I'm going to call him. We're going to have a conversation. No, he wasn't available. I'm going to pick up a new hobby, right? I'm going to actually have 1 or 2 less things to do with school, and I can get my taxes in on time, right? Dopamine allows us to keep pursuing life. and get better at life, including the ability to finish tasks. So don't forget to think about cannabidiol for attention deficit disorder with any patient population, but especially if you're having issues with getting stuff done, you're feeling kind of down and hopeless, depression's creeping in, I don't know if I want to go to Pilates. If you're feeling all that, you got to think about cannabidiol as a dopamine 2 agonist. It literally binds the D2 receptor and helps bring back in that lust for life. Adenosine. Adenosine is a really wild molecule because it has a lot of benefit on modulating the nervous system in regards to cardiac phenomenon. So I will use cannabidiol a lot if someone has arrhythmias around perimenopause, menopause. And I always do my diligence. I'm going to put an overnight oximeter on them, make sure apnea didn't kick in and drive arrhythmia, watch for blood sugar, look at thyroid hormone levels, not too high, not too low, look at Marcons in a SIRS patient, which also drives arrhythmia through polycyclic ether, polycyclic ester, deal with their caffeine abuse, and so on and so forth. But as you're pulling people down on 4 quad shot lattes a day, cannabidiol can help regulate rhythm by interrupting caffeine's effect on the adenosine receptor. It's a super awesome multifactorial balancing molecule, including helping address caffeine toxicity through the adenosine receptor. Neurotransmitter reuptake inhibition. So what's incredible about cannabidiol is it works to recycle serotonin, dopamine, and GABA binding in neurotransmission. So it keeps the molecules of enthusiasm, ambition, and drive, and cool, calm, and collected going in the brain. I took the job of research and development at Blue Sky during COVID. And while everyone else was just crumbling with this crazy healthcare phenomenon, I was in a Tyvek suit in a parking lot, the first to get COVID testing in our town, because I felt ready and empowered, and it wasn't going to crumble me because I had my enthusiasm, my GABA, and my dopamine. And I'm going to tell you, the closest thing that I see cannabidiol do is to very regular, moderate exercise. It's very much like a runner's high, or the way you pop after a CrossFit, or a beautiful hike when you smell butterscotch pines, or a perfect powder skiing day. It's a very similar hit to the brain and body. We also use it to help stay in the game of workouts and recover better. So, is CBD an endogenous cannabinoid? No, it's an exogenous cannabinoid that modulates your self-made cannabinoids, including anandamide, PEA, and oleoethylamide. PEA and OEA are the self-made cannabinoids you make from palm oil and from olive oil. This is probably part of the benefit of the Mediterranean diet. You're eating all that olive oil, you're making these anti-inflammatory OEAs. So healthy fats, balance the blood sugar. If you're carnivore or ketogenic, make sure you have adequate ketones to run your life, and make sure you're addressing endogenous cannabinoid deficiency syndrome, and pure CBD can do that. It's a novel neuroendocrine immune modulating anti-inflammatory. So it balances the brain, the endocrine glands, and immune system. It's an endocannabinoid promoter, so it helps recycle and replete your washed out, depleted bank accounts of self-made cannabinoids. It's an isolate from the hemp plant, but it is not whole hemp. Ethan Rousseau, a premier researcher in phytocannabinoids, talked about you may need the entourage effect as a thought in the shower that he wrote in an abstract. You do not. All of the research, whether it's on Parkinson's or MS or anxiety or depression or smoking cessation or IBS or headache, is on pure cannabidiol. It is not on full hemp extract. And I'm a little nervous about full hemp because I've actually aggravated some of our autoimmune patients, probably by pushing the wrong lever in their Th1, Th2 immune responses with all of the ingredients that are in the hemp plant. There's about 100 ingredients in there. Cannabidiol lives more in the EPA, DHA fish oil, vitamin D3, K2, probiotics, and short-chain fatty acids, where it's an immune modulator. regardless of which direction the immune system is spinning out, like a Th2 asthma allergy case or a Th1 rheumatoid arthritis case, it's going to bring you to the middle and make sure that you're doing okay. So it's a safe alternative to many over-the-counter prescriptions and anti-inflammatory. When we're supporting a benzodiazepine taper and people are getting off Xanax and they're clawing the frickin' chalkboard, the conventional approach is sliver a little bit, wait a couple months. Sliver a little bit, wait a couple months. We are going to add 75 to 300 milligrams of pure cannabidiol, and you will be blown away by how many perimenopause, menopause women are on benzos. And we never knew that because a lot of them are embarrassed or ashamed about it. There's no judgment in my clinic. A worthless wretch like me is never allowed to judge what walks through the door, right? Who am I to pick on you for bulimia or drug addiction or having 17 drinks while you're trying to raise 3 kids, right? It's not on me. What I want to do is figure out, what are you trying to medicate with those illicit or over-the-counter or recreational drugs or irresponsible prescribed drugs, right? And benzos are going to be everywhere in your perimenopause, menopause population, and pure cannabidiol helps you transition and taper off the benzo with grace and a lot more ease. So know that you always want to work with your prescriber on that, but we always are going to add cannabidiol to a benzo taper. We're going to try and get them moving. We're going to balance the blood sugar. I'm also going to add the Blue Sky sleep gels, 1 to 2, 30 minutes before desired bedtime if difficulty falling asleep, at bedtime if difficulty staying asleep, and then have some of the sleep gels bedside. So if you bing, wake up at 3 a.m., you can take another one and try and get back to sleep. Get restorative sleep, wake a little spry and go, maybe I will do a little yoga or foundation training this morning. Maybe I will go to that Pilates class and then slowly, successfully taper off that benzo. It's an amazing miracle molecule for supporting benzo taper. So CBD is not THC. Hemp has 0.3% THC or less. Even that can get some of our patients high in the super sensitives. I see a lot of chronic mystery illness who are hypersensitive, MCAS, and all kinds of sensitivities are down to eating lamb and bone broth. Those are the people who are even going to get high off 0.3% THC. And then some of our products are labeled as such, but they're not purity and potency tested, and they might have 5% THC. CBD is not intoxicating and does not get you high, but it does have psychoactive effects. So I hate that people say CBD is not psychoactive. I just told you about serotonin and dopamine and GABA. It is a cool, calm, collecting productivity molecule that helps you feel uplifted, capable, a little more stamina, and relaxed, not sedated, but your shoulders are down while you're crushing your day. So CBD does not show safety concerns of liver, kidney, and intestinal lining damage like non-steroidal anti-inflammatories do. I am not anti-Advil, aspirin, Tylenol, and Aleve when judiciously applied, and I think something like Advil and Tylenol post-op is 100 times better than OxyContin. But you want to also use the Max Relief Balm on your replaced hip joint as soon as your surgeon says it's okay, and the Max Relief CBD CBG orally at 1 to 2 droppers 2 to 3 times per day to see if that manages your pain well enough, and then maybe you save the Tylenol and the Advil to really bring down the pain so you can sleep, right? We want to avoid the oxy if we can and not turn you into a Purdue addict. So CBD and menopause. We talked about how important dopamine, serotonin, and GABA are in regards to feeling cool, calm, and collected. One of the biggest things I see in perimenopause, menopause, if you're not watching the oxygen, the blood sugar, and supporting the hypothalamus, pituitary, adrenal gland, is the anxiety just takes over. And all of a sudden you become a worrywart. Cannabidiol can be a miracle for that. When you start having lousy sleep, maybe you need 100, 200 milligrams of progesterone with your prescriber, but absolutely start with the sleep gels and realize bringing down inflammation allows your hormones to work better anyway. So if you're full of inflammation, it's like those cytokines are like sticking gum inside of a door lock, so the progesterone key can't even bind. So the sleep gels, the CBD, moderate exercise, blood sugar stabilization, steady oxygen, they all help keep inflammation down. So if you do need a little progesterone, it works better. The key binds in the lock and helps promote GABA and a good night's sleep. So menopause brings declining DHEA, estrogen, and progesterone, key regulators in inflammation. CBD supports serotonin, dopamine, and GABA receptors, brings down inflammation so those hormones can bind. CBD promotes serotonin for enthusiasm, GABA for feeling cool, calm, and collected. Progesterone binds GABA too. So there's a natural synergy with cannabidiol and the CBD, CBN Blue Sky Sleep Gels. So CBD for sleep. CBD provides serotonin binding, but the biggest thing I'm going to tell you cannabidiol does is at the end of your day, you're not going to be such an inflammatory bomb that corrupts the release of melatonin and subsequent growth hormones. CBD also allows you to calm down, and up to 300 milligrams of CBD doesn't interrupt sleep architecture. So in the first presentation I gave for Blue Sky, I said CBD might not be the greatest for bedtime because it's an uplifting productivity molecule. Then they gave these people 300 milligrams of CBD and it did not mess with sleep architecture. THC does. THC is like a glass of wine. I'm not anti-cannabis, but booze and THC help us fall asleep and then bing, wake us up at 3 a.m. Don't forget the munchies is a hypoglycemic attack on the brain where THC triggered glycogenolysis. You had a big glucose spike, an over-exaggerated insulin response happened. It sucked all that glucose out of your bloodstream into the cell and created a hypoglycemic attack known as the munchies. That is where a lot of people get extra anxious and paranoid and have existential crisis off eating a little bit of a gummy or smoking a joint. And CBD is blood sugar neutral. So for the doctors, in 20 years of dealing with chronic illness, including insomnia, underlying cause of inflammation, as the notorious culprits of ruining the sleep party, right? It's the gosh darn inflammation. You want to make sure that you screen your patients for oxygen drops, blood sugar drops, electrolyte issues like hyponatremia or low sodium, T3 thyroid, get those anabolics, DHEA, testosterone, estrogen, progesterone dialed in, but use cannabidiol as this miracle molecule that gets the symphony working together. CBD not only enhances your self-made cannabinoids, but also dampens the cytokine storms known to disrupt sleep architecture. It was part of our program for COVID. We had 3,000 patient contacts, 0 COVID deaths. America has 4% of the world's population and 16% of the world's COVID deaths. Why? COVID is a gnarly virus, but COVID doesn't kill people. Your nonsensical self-made immune responses to the COVID kill you. There's a molecule that we learned from Dr. Shoemaker and SIRS called transforming growth factor beta 1, TGF-beta 1. TGF-beta 1 is necessary to create pulmonary fibrosis or scarring of the lungs. If you control the inflammatory responses of the COVID, no one's dying, right? And that's what we showed in our clinic. We had 2 ICU admissions, 0 COVID deaths, and in all sincerity, those 2 folks did not implement our treatment plan for them, which was always about modulate and balance the inflammation. It's about immune modulation. Too little and you don't fight cancer and viruses. Too much inflammation, you burn down your lungs, throw clots, create myocarditis, sit there brain dead with post-COVID SIRS, right? Post-COVID long haulers are chronic inflammatory response syndrome where their body is turned on the chronic production of inflammation. Cannabidiol can be a miracle molecule for dampening that. All right, so poor sleep increases inflammation, accelerates aging, and dysregulates hormones. CBD-CBN may reduce inflammatory cytokines, allowing the brain to secrete melatonin and growth hormone. Moderate exercise and restorative sleep are true panaceas, right? If I see anything get people better, it's, oh my gosh, my sleep scores on my smartwatch or my smart ring went from the 30s and 40s up to the 80s and 90s. Customers report that all the time with the Blue Sky Sleep Gel. If you have a smart device, put the Blue Sky Sleep Gel to the test. It's 1 to 2, 30 minutes before desired bedtime if you have difficulty falling asleep, 1 to 2 at bedtime if you have difficulty staying asleep, and then keep some by your bedside. I have no issue with people taking 2 to 4 a night through the night to get back on sleep cycles, and then you can usually back off down to 1 to 2 once you get those sleep cycles going. But put our sleep gels to the test on your smart devices. You will be blown away on how your body battery and how your sleep scores go from the 30s, 40s, 50s, 60s into the 80s and 90s. So really proud of helping the world get a better night's sleep, because it creates a more peaceful, graceful, kind, generous, capable, productive, creative, joyous society. And that's what our company really enjoys. When we read our reviews and someone's out of pain and they're sleeping better and their mood is up and they can work out again and they can be a better mom and take care of their aging parents, and it's the simple things in life, right? We just want to take care of our loved ones and enjoy our communities and not be in pain and depressed and beat down with exhaustion, right? So that's what we're suggesting there. So nothing is more anti-aging than good quality restorative sleep. So for pain, we want non-addictive, non-psychoactive, meaning people sometimes feel better on THC gummies and then they'll tell me, I don't want to be high, but I do enjoy the pain relief. Cannabidiol does not need THC to work for pain. That's another folklore natural medicine artifact. That is not true, and there are pure cannabidiol studies. In cancer studies, THC needed CBD to actually help with pain syndromes. So CBD and CBG are wonderful non-THC molecules that work as isolates, and even better, a 1 + 1 = 3, and that's our Max Relief formula. It is literally 2 parts CBD to 1 part CBG, which is the Rolls Royce of the hemp plant. Only 1% of hemp is CBG, so most companies don't put therapeutic levels of CBG in their products. We load it up. The #1 blue sky selling product, which is really proof that it's working. No one comes back and keeps buying stuff. It's not doing anything for them. Is the sleep gel. The #2 is the Max Relief Balm. And we have so many 45 and older who use the Max Relief Balm. I've been using it for a while now at any age for athletic performance, right? Someone tweaks your elbow in jiu-jitsu, or you tweak your ankle training for the boulder, or you have musculoskeletal pain when you tweak yourself. Get your form, get your posture, do your better warm-up, but just throw the balm on there. And that also helps with sleep, because pain is a drain, and pain can be an issue for sleep. I'm laying on this hip, now I got to shift to this hip, and so on and so forth. So CBD showed modulation attenuation of endothelial nitric oxide synthase, which also allows enhanced blood flow and a healthy endothelium, the inner lining of the artery, to deliver better, fresh, oxygen-dense, nutrient-rich blood flow to the tissue that's pissed off with an ankle sprain or a pickleball elbow, right? As a standalone neurotransmitter, glycine mediates nerve pain and inflammation. CBD dampens that nerve pain. So post-herpetic neuralgias, peripheral neuropathies, I'll just rub the Max Relief Balm all over someone with peripheral neuropathies, legs and feet, give them the Max Relief, and they feel awesome. With our Parkinson's patients, we'll often start with CBD and then we'll move to the Max Relief if tremor and gait and pain and masking and uplift is not improving. It's amazing to see CBD and CBD-CBG Max Relief work on tremors, work on affect, work on seeing your Parkinson's patient smile and not be so frail. The #1 issue with Parkinson's is movement disorder. #2 is anxiety. So you'll see these people, predominantly men, right? We have more female MS and more male Parkinson's. These predominantly men who were running companies and doing all kinds of things. Now all of a sudden they're like this frail, anxious shell of themselves, and cannabidiol can restore some of that integrity and dignity in their affect, so they're not so fragile. So on this study, it showed that cannabidiol affected this orphan receptor, this very unknown glycine receptor for pain. So anything neuropathic pain, think cannabidiol, Blue Sky Original, and or Max Relief, the CBD CBG. We just learned that gabapentin got added to the aging brain list, right? So now we have gabapentin, benzodiazepines, a lot of our antihistamines like Benadryl, all age your brain while giving you temporary relief. We have to find an alternative. We don't have human trials on CBD and CBG yet for Alzheimer's, but mouse studies are incredible on CBD. So for a perimenopause, postmenopause, when your brain is going down a little bit and the brain fog kicks in, that's inflammation, and the CBD will help with that. The little mice were antisocial and couldn't find the cheese, and then on CBD, they started socializing and congregating and could find the cheese. That's the basic review of the mouse studies on dementia. So when we're dosing, I've been saying this over and over again, but there's one drug interaction you want to watch out for, and that's Coumadin, warfarin, heparin. That's the original old blood thinners that people don't use that much anymore. CBD and Coumadin, heparin, warfarin take the same clearance pathway in cytochrome P450, phase 1 detoxification. They both take the same exit. So in theory, CBD could back up your blood thinner and make your blood more thin. I'm going to tell you, when you're using those, you just follow an INR to see what the blood thinness is and how quickly the blood clots. I gave an old construction worker who helped build out our office 300 milligrams of CBD while on Coumadin, and his INR didn't change. And I'm saying that because you can still apply it, but that should be done under supervision and monitoring the INR. And you move slowly. And that's more for the providers than it is any patients or citizens or the public listening to this talk. Do that with your provider, but you're going to find that so many people are so scared of natural medicine and don't know how to apply it to therapeutic doses, whether it's vitamin D or whether it's cannabidiol. When we're dosing cannabidiol, we like to do the Blue Sky Gel, the original gel challenge. We have people buy the Sky Gel samples or a bottle, and they chew up 2, and they see how they feel. If they don't feel anything, 15 minutes later, they chew up another 2. Each Sky Gel Original is 30 milligrams of pure cannabidiol. So that's 60 milligrams, 1 to 2 times over a 15-minute experience. If you feel really good on that, we tell you to buy the tincture because it's expensive to encapsulate, and the tincture can bring on really good savings. A full squeeze into your tincture bottle where about half of the glass is full, it's about 75 milligrams of CBD. So it's about 1 dropper full in the morning, 1 dropper full in the afternoon in regards to using CBD to get this uplifting productivity molecule. On the severe cases of stress, which was frontline workers during COVID, before we really understood COVID as just another coronavirus that triggers even more inflammation, Brazilian doctors and nurses got a DVD and for exercise program and therapy versus a DVD and exercise program and 300 milligrams of pure cannabidiol. And the cannabidiol group had statistically significant lower rates of anxiety, depression, emotional exhaustion, and worker burnout. How much CBD from Blue Sky was I taking during COVID? 2 dropperfuls in the morning, 2 dropperfuls in the midday to get through my day. And that was before the study. And then the study came out, and I was like, oh, no wonder I'm rolling. Let's go. I've been training my whole life for not the virus, the nonsensical, self-made, overzealous response to the virus that burn down our lungs, clot our blood, inflame our cardiac muscle, and drive myocarditis, leave us brain fogged, fatigued, and exhausted, right? So about 1 dropper in the morning, 1 dropper in the afternoon, if you're working through a case like arthritis, but you can go up to 2 droppers 2 times a day. If you're not getting benefit there, move to the max relief. Those are 2 parts cannabidiol, 1 part CBD relative to the original gel. So a 30 milligram Blue Sky Original Gel is 30 milligrams of CBD and 15 milligrams of CBG in a max relief gel. Same with the tincture, but 75 milligrams of CBD plus about half of that in CBG. So if One dropperful twice a day isn't working. I go to 2 dropperfuls of the original CBD twice a day. If that's not working, I go to 1 dropperful of Max Relief twice a day and 2 dropperfuls of Max Relief 2 times a day. I'm going to tell you, the more your inflammation, let's say you're in a postmenopause rheumatoid arthritis or a lupus or an ankylosing spondylitis or a psoriatic arthritis or a migraine flare that really upticked, you start with the original and you move to the Max Relief. Any body part that's hurting, you're going to put that Max Relief. And anybody who's having sleep issues, you're going to do the 1 capsule of the sleep gels at 30 minutes before desired bedtime. So if I want to go to bed at 10, I would take it at 9:30. And when that window opens up, get in bed. If that's not working, I go to 2 30 minutes before desired bedtime. If I have trouble staying asleep, I'm going to take it right at bedtime. If I have trouble both, I have trouble falling asleep and staying asleep, I'm still a half hour before desired bedtime. And then I'll keep a little bit of sleep gels next to my bedside with a glass of water, and I'm going to take 1 for every big waking, no more than 4 through the night. And 2 weeks in, my sleep is usually dramatically improving, and I can reduce the dose just from a cost perspective. It's not a safety issue there, but we want you to get maximum benefit for maximum value. So that's how we're going to dose. And again, the real thing you want to watch with interaction is the old blood thinners. The new blood thinners, Xarelto, Pradaxa, and Eliquis, take a totally different pathway of clearance, and you don't have to worry about those. So, like shopping for high-quality fish oil, hemp product labeling can be misleading and confusing. When shopping for fish oil, we are most interested in the EPA DHA levels, as that's what's published in the studies to change things, like the 2,000 milligrams of EPA in the Japanese men for the Jellis trial is what reduced heart attack and stroke. So we don't care so much about the other fish fat. We care about the EPA DHA. DPA also has a little bit. When you're looking for CBD, we don't care about hemp, right? We care about the cannabidiol. So you're not looking for a hemp extract with 500 milligrams of CBD. You're looking for a whole bottle. Our 1 ounce Blue Sky CBD is 300 milligrams of pure cannabidiol with no other ingredients in it. And you're not going to find a cheaper per milligram value per CBD milligram or CBD CBG milligram or CBD CBN milligram. So you pay for what you get. Learn how to read labels for you and yourself, but learn how to read labels for your patients. So if a bottle says 3,000 milligrams of full spectrum hemp, this does not mean 3,000 milligrams of CBD. Moreover, if they don't report the CBD content, you should be suspicious or at least realize they are not doing analysis for CBD quantity, and you really don't know what you're getting. So how am I going to imitate a study in the medical literature if I don't have an actual CBD count with certificate of analysis? So our mission is to formulate and manufacture world-class formulas to assist in creating healthier communities. It's so fun when we hear people do better. My favorite conversation is a customer named Tommy, who's not a patient of mine. He actually called me and I said, bro, I love you, but I don't see cancer. He had metastasis to the bone. He lets us tell his story. He actually did a sweet, quote-unquote, commercial for Blue Sky where he had stage 4 cancer metastasize his bone and nothing worked for his pain, including OxyContin and poppy derivatives. Nothing worked for his pain. We gave him the CBD. It really helped for his pain. We gave him the Max Relief, it helped more. We gave him the internal Max Relief gel and the topical Max Relief balm, and he could sleep through the night and die in dignity. It was an incredible story. He's no longer with us. We miss you, Tom. His wife is also just such a lovely woman, incredible wife, incredible human being, but we got to support dying with dignity and not howling in pain. As a guy who started on the ambulance and in hospice, can't tell you how much that meant to me. So again, when you're looking for alternatives to non-steroidal inflammatories, to OxyContin, to benzos for sleep, for pain and mood, for our psychotropic medications, you want to think about cannabidiol and the endogenous cannabinoid system. You want to think about CBD, CBN for sleep. You want to think about CBD, CBG for pain. We got guaranteed purity and potency. Every batch is third-party tested certificate of analysis, 0 THC, trusted by healthcare professionals worldwide, third-party lab tested, readily available certificate of analysis, ongoing partnerships with people like the Colorado and Arizona Naturopathic Association. I'm going to speak to the Parkinson's Association today. Love seeing those men and women, predominantly men, feel less anxious and have better movement and coordination, see smiles come back, and 50% margins guaranteed on all products to our wholesale providers. So this is a miracle molecule that can really help. The original is the blue label. The Max Relief is the green label, and that's again 2 parts CBD to 1 part CBG. Very generous, incredible value for the CBG milligrams per bottle. We're super proud of that price. You will not find CBD, CBG at that level for the cost, wholesale or retail. It's really as cheap as it gets. And then the sleep is 1 part CBD to 1 part CBN, 25 to 25, which mimics the 20 milligram of CBD, 20 milligram of CBN published study on improved sleep quantity. And then here's our bombs. The blue is the original. I love the blue. But if you're really in pain, I tell people go for the green, which is the Max Relief. This is a massive amount of CBD, CBG, 2,500 milligrams in a roll-on. And there's also lip balm size samples. So if you're not sure if it works for you before you buy the big roll-on, which lasts forever, by the way. I give these to my son's basketball team, and it's like a year and a half later with the little lip balm one, they ask if they can have another one. You're going to rub it on the painful area, give it a minute or two if you have time, rub it, massage the joint, get it in there. Be careful to not touch your privates or your eyes because there is a little bit of wintergreen in there. The point of the wintergreen is to open up the vasculature to deliver the CBG a little bit better. It also smells really nice. And then we have the sleep balm as well. We have some couples who will massage. We have some people who don't have a partner and they rub it on their feet. So any way and anywhere you want to apply the bombs can be helpful, but a lot of people love rubbing the sleep on their feet or on the back of their neck and just induce a good night's sleep. That's all I got for you guys. I look forward to having follow-up time for questions and answers at some time. But if you do half of what we said in today's talk, you're going to find dramatic improvements in clinical outcomes for your perimenopausal and menopausal patients. If you're going through perimenopausal menopause and you're listening to this as a non-patient, we really want to thank you. Women make the world go round. I don't know anybody who did more things for more people than my mom. And when you're spread that thin, a constant sense of urgency is also inflammatory. So make sure to take time for yourself. Make sure to know that you are appreciated. We see you. I am a blessed adult who got to see the best of a mom, a wife, a daughter, a kindergarten teacher, a member of our community who was just such an incredible person, but still went through a little bit of a hard time with inflammatory cytokines when it came to perimenopause, menopause. So take care of yourself, make time for yourself. Taking care of yourself allows you to take care of others. So we wish you all the best, and hit us up with any questions you have about graceful transition for perimenopause, menopause, and what these beautiful phytocannabinoid isolates can do for you.